Access to clean drinking water and safe sanitation are top global health priorities. As Kenya strives to ensure equitable and universal access to this precious commodity by 2030, the demand remains high in the arid and semi-arid regions like Narok County. My name is Gloria Milemu, and on this episode of Health Digest, we look at how the availability of this precious commodity is helping transform the lives of members of this community. It is one of the most important natural resources. Yet, it remains at the core of sustainable development. At the human level, water cannot be separated from sanitation. In many ways, public health experts say this precious commodity plays a critical role in the reduction of disease burden, improving health, economy, and even education. However, many are still grappling with water scarcity, a situation that affects at least 2.2 billion people globally who still lack access to safe drinking water. For school-going children, availability of water and good sanitation cannot be overlooked. It is indeed argued that quality education requires a healthy, enabling environment for students. In other words, water is just as essential as books in schools. In schools like Oldonyo Orasha Primary in Narok South Sub-County, improved access to clean water and sanitation facilities continue to create a conducive and enabling learning environment for these pupils who initially lacked the facilities. Access to water, hygiene and sanitation in schools or WINS is the right of every child. But for this community, this right remained just on paper until 2 years ago when the school's water shortage was addressed.
After rehabilitation of this borehole, we got clean water with very little salt. So the water is almost clean, no salt in fact. We are using water for drinking, we are using water for washing, and it has no effects. After the project was started, learners used to carry water using jerrycans and small containers. Some of them used to come with dirty water from their ponds, from that seasonal river, from other wells that are more salty. But after this project was erected, the children can no more carry any water. So water is available here in school, and not just water, but clean water.
Experts say safe drinking water, basic sanitation, and proper hand hygiene are essential for the health of children. So much so that child health experts warn that in the absence of water, children become prone to diseases and infections. When they cannot wash their hands, they become susceptible to diarrheal disease and other infections that force them to miss school.
We used to have these waterborne diseases due to this contaminated water, like typhoid. Typhoid is common around. We also have some cases of cholera there before. I think it was around 2019 to 2020. That area is just this one, not far from here, almost 7 kilometers away, that we had that outbreak of cholera, and I think it is just because of that water. There are these intestinal worms, infestation of the worms. So severally, or in most cases, children do absent themselves because of these diseases. And there are diarrhea, vomiting, those are the cases around there before. But nowadays, at least it has improved.
This was the same case for the 335 pupils in Oldonyo Orasha School. According to the school's head teacher, Samuel Kewa, they now have access to clean water, functional toilets and bathrooms. Above all, they practice proper hand washing techniques.
We used to have lack of concentration of these young ones, especially after lunch, because of lack of water. So instead, after lunch, they go back to get water maybe for drinking. And then our big girls, adolescent girls, before the project started, they used to absent themselves because of maybe the menstrual cycle. But nowadays, imagine they come very early in the morning, come and change here in school, maybe shower here in school because of the facility.
When you take children to school, what is it that you want to address at the same time? Children go to school to learn, but you must look at the environment under which these children are going to school. We must look at the environment where these children are learning. Starting from the class, look at the sanitation facilities, look at the water, yeah? And the general environment where they are playing, just to make sure that children are not harmed when they are doing their normal chores. This will contribute to children's learning opportunities, and children who have such facilities are able to attend school, and they are able to transition from class to class, and they're able to transition to high school and even to university. So it's an opportunity for all of us to give children an opportunity to go to school and pursue their dreams, because children are the leaders of tomorrow, and they are the people we look unto to continue leading this nation and developing this nation.
Similarly, the availability of water has also facilitated the need to equip the learners with knowledge on climate change and its effects, and how tree planting can help improve the environment and create a conducive learning space for them.
This water has helped us a great deal. There before, this place was not that good to stay, but nowadays you feel like staying around. Every teacher wishes to come here because of maybe the nature now. We have the trees, we have the garden, we have water in plenty, and they say water is life. And they brought life, we thank God for that. And we're so excited. Sanitation is highly maintained, cleanliness is observed at whatever level, and this water has helped us a great deal.
We also initiated a school feeding program because of the availability of this water. The parents do facilitate the buying of maize and beans, but the school has this clean water, so we use it for cooking, drinking, because it is safe for drinking.
Drilling and rehabilitation of boreholes in 6 schools in the county played a key role in improving access to water. At least 2,452 pupils in 6 schools in the county can now enjoy safe water and sanitation and hygiene facilities, according to experts.
We are addressing children because children congregate in schools, and they are in big numbers. You hear of a school with 1,000 children, we hear of a school with 2,000 children, and you hear of a school that have 200 children, and children who have no sanitation facilities, children who are not practicing good hygiene. And with that congregation, it becomes a fertile ground for disease transmission.
Access to quality healthcare and clean water, sanitation and hygiene services, or WASH, are basic human rights, according to the Constitution of Kenya. It also aligns with the United Nations Sustainable Development Goal number 6 that calls for availability and management of water and sanitation for all. Currently, the world is grappling with adverse effects of climate change, and Kenya is not spared. But its impact on the arid and semi-arid lands like in Oldonyo, Russia, in Narok South Sub-County has been severe. It has strained the limited natural resources.
When water is scarce, water is prone to get, the little water that's available is prone to get contaminated. And when this water is contaminated, people are prone to get diseases through this contaminated water. Majority of patients that we get are patients who come to be treated of fecal-oral infections, and both to under 5s and adults. Mostly what we get is diarrheal diseases and also typhoid.
Ukioga na hiyo maji ni ya chumvi. Hata ngozi naye ukioga unakutikana unaangaliwa wewe ulikuwa mweupe, umekuwa saa zingine vitu zinatoka kwa ngozi kwa sababu inaafektiwa na hiyo chumvi kwanza. Na ugonjwa ingine ikiwa chafu, ikielekea kuwa chafu, kwa sababu nimekuambia it is not a permanent river, it is a seasonal river. Ikiendelea namna hiyo inakuwa green, saa zingine inakuwa nyeusi kwa sababu ya hizo mauchafu ya hiyo mauchafu. Cholera inaingia. Kuna hata hii tunaita hii inaitwa typhoid inaingia. Watu wanapelekwa hospitali sana. Maji ikiendelea kuwa chafu, watu unakuta tu mtu amepelekwa anahara, unakuta mtu mwingine anapelekwa ni typhoid ya tumbo. So tunapata hizo changamoto sana, na hata malaria iko kwa sababu ya mosquito. Inaweza kuwa kwa sababu hiyo maji inakuwa saa zingine inapata pahali inalala, mosquito inaingia, malaria inaingia. So changamoto ni ya ugonjwa ni hiyo.
He says water scarcity forced residents to turn to contaminated water sources, which also took hours to reach. In areas like this in Narok County, it is not uncommon for women and girls to spend up to 2 hours in search of a safe source of water.
Tulikuwa naenda kuleta hiyo maji kwa mbali. Tunabeba kama mtungi 2 ama 3. Juu tunapeleka funda, kuleta na funda. Hiyo maji kuna wakati utakaa mpaka kuwe green, na bado tunatumia, utapika tu alafu tukunywe. Tutawasha naye nguo juu hatuna na mali nyingine.
Before tupate hii maji tulikuwa tunatumia mto ambaye inaitwa Olare River yenye iko side ya Chidi, pahali mlikuwa mmetoka mkikuja hapa. Na hiyo maji ni seasonal river, sio permanent river. Wakati ya mvua ndio ilikuwa tunapata maji ikiwa safi kwa sababu ya wakati ya kunyesha tu. Alafu changamoto nyingine tulikuwa naye, hiyo maji yenye tulikuwa tunakunywa wakati hiyo ikiwa inanyesha, hiyo usafi iko wakati inanyesha. Lakini kiendelea tunakunywa na wanyama kama ng'ombe, kama saa zingine wildebeest, masebra, na watu kuoga kwa hiyo river kwa sababu hakuna maji nyingine. So tulikuwa tunagombana na hiyo changamoto kwa sababu ya hiyo maji ndio tulikuwa tunasingira sisi wote.
Rehabilitation of boreholes at Oldonyo, Russia Primary School has facilitated the availability of clean water for the residents too. According to engineers, the water system spans 2 kilometers, linking to a 50,000-liter reservoir tank. This distributes water to 3 water kiosks where the residents can easily access it for their use. Their animals also quench their thirst at these kiosks that are fitted with watering troughs.
So many ladies, women, come from far to fetch water from that point at the end of the school compound. Some of them come with motorbikes to take water as far as 5 kilometers because it is clean and safe water. So it has really assisted the community. That's why you can see most of the community members are around because of that water. Some are coming to take maybe that water for domestic use and some for drinking. So it has really assisted the community. And the community is appreciating anyway. They are doing several repairs within this project. They are the ones who facilitated the digging of the water pipes, the digging of these terraces from here, from the borehole point to the kiosk, and from the kiosk to that village, Oyarata, and Kesumeti, more than 2 kilometers away.
This is a solarized borehole of a 7.5 kilowatt system with a borehole capacity of 10,000 liters per hour. By estimation, this is going to serve close to over 7,000 people in the next 25 years. So the way we design projects is we design them for 25 years, and we continually monitor them just to ensure that they're in line with the overall goal or the long-term goal. We were able to train the Water Management Committee. And the Water Management Committee is localized, and these are trained. We did some workshop training and we did some on-site training. So to be able to upskill them or give them the skill to be able to maintain. And in areas where they are not able to maintain, where they do not have the expertise, they're able to we've provided a list of experts, electricians, and even plumbers who are able to come and fix it. So the way the water supply system operates, the community pays for water. And from that basket of revenue collected by the Water Management Committee, they're able to pay for skills that it's not locally available within the project area.
Availability of safe and clean water, according to the county's WASH coordinator, has helped in taming public health threats that emanate from consumption of contaminated water, especially in the sub-county.
We already have seen a tremendous reduction of cases that we've been seeing in our nearby health facilities. Initially, we had a large number of pupils being tended to in terms of fecal-oral infections, but of late we've seen a quite reduction of numbers of those whom we are receiving at the health facilities.
Whereas this natural resource is helping transform the health outcomes of residents here, the major challenge now remains appropriate disposal of human waste to avert environmental contamination in the sub-county. Out of the 2,800 villages in Narok County, at least 780 have been declared open defecation-free zones. However, in Narok South Sub-County, where Oldonyo Orasha village is, the toilet coverage, according to the local leaders, is only 30%.
Ni kumaanisha kwa kila boma tatu ni boma moja tu ambaye iko na choo. Hiyo 30% kweli wazee wenye wako hapa ni statistics mzuri ama lazima tufanye jambo? Muko sawa na hiyo ama tufanye kitu? Mimi nasema hivi, katika hii karne na ulimwengu wa leo ambayo ni digital, ambao tunaongea maneno kubwa, climate change, maneno ya food security, water security, ni makosa Mkenya yoyote kukua kwa nyumba yake hana choo. Na nafikiri imefika kiwango bwana PHO na watu ya health na idara yetu ya interior sasa tuamuke na tuanze kwenda door to door, na tukipata wewe hauna
sheria ya public health inaruhusu upelekwe kotini kwa kuharibu mazingira ya Mungu.
6 villages around this school have already been triggered in terms of implementing what we are calling community-led total sanitation, and I'm happy to report to you right now around 60% of in the villages have already constructed and are using latrines. We are hopeful but that by the end of the next 2 months, everyone will have a latrine and will be enjoying using them.
According to the Kenya Demographic Health Survey report of 2022, open defecation is practiced by 7% of the population. Currently, 80% of households in the country have improved source of drinking water. This percentage is higher in the urban areas compared to the rural areas at 94 and 71% respectively. The report further sees at least 51% of the population has access to basic hand washing facilities. Even as Kenya strives to achieve Sustainable Development Goal number 6 that calls for universal access to safe water, dignified sanitation and hygiene for all by 2030, experts advised the need for the government to continuously improve access to healthcare and wash through robust investment to fully meet the goal. Gloria Milemo, KTN News.